Mr. Jones. My name is McKadee and I'm going to be your nurse today. I would close curtains or close the door, make sure our patient has privacy. And Mr. Jones, can I get your name and birthday? Perfect. So the doctor has ordered that we give you an indwelling catheter to help with your urine elimination. Does that sound good with you? So I've gathered all my supplies. I'm raising the bed to a good working height. I have a trash can here. And so Mr. Jones, do you have any allergies, especially with latex or iodine? No? That is good to hear. So I will start by doing pericare. Okay, Mr. Jones, I'm gonna have you spread your legs apart and put your feet together. Thank you. And I'm just going to clean the pear area. I'm going to expose you for a minute and just clean. So I'm going to hold the penis and I'm going to clean around the head, making sure to use a clean part of the wipe. I'll get a new wipe. Do one more wipe around the head and then clean part, go down the shaft. And clean part the other side of the shaft. And down the back. I'm going to gently cover him so he's not exposed. I'm going to remove my gloves. So Mr. Jones, when inserting a catheter, it may be uncomfortable and cause a little bit of pain, so just let me know if you're having any pain or tightness and we can help you to the best of our abilities. So I'm going to open my cath kit. So opening the cath kit, I'm going to make it so I open the first side away from me, second side away. Plug them tight, making sure to only touch the outer 1 inch. So now I'm going to use the sterile gloves that I got before. I'm going to make sure to open these on a clean surface that isn't used. So I have a different table than the one over there. I'm going to lift up this glove by the cuff on the inside and insert my right hand. And place this hand under the cuff. And making sure I'm not touching it and I'm far enough away from the table as I put these on. Then I can go under, making sure to only touch the outside part. So I'm going to move my supplies, and while my hands are sterile, I can move stuff around. to open my swab sticks. Open the lubricating jelly. And here I'm going to pull out my catheter, so I'm going to rip this. And then I'm going to coil it up in my hand so that it isn't touching anything. I'm going to stick that in the lubricant and put it there. Also, I'm going to take out this spot and I'm going to put the syringe on it to inflate the balloon. I'm going to take out my swabs and also place them in there. So I'm going to place my first one on, making sure not to have it touch me or anything holding it for me. And then, as my assistant, can you please pull back his drapes and expose him? Thank you. So again, making sure not to touch me, his leg or anything. I'm going to place this under him and open it up. I'm going to get the second one. Again, hold it away from me. And I'm placing this one over the patient. I'm going to take the box of all of our supplies and place it between his legs on our sterile film. And with the lubricant, you need to make sure that for the melt, it is down further. Or if it comes with a syringe of lubricant, you can insert it into the meatus of the penis and insert the amount of lubricant directly into the penis. And again, I'm just going to keep that in there. Try to help not get everywhere. So now I'm going to have my left hand not be sterile, and I'm going to grab the penis, and using the cotton swabs, I'm going to grab one and go around the head, disposing of it, getting a new one. I'm going to go around it 3 times, keeping it sterile and clean. Now I'm going to take out the catheter from the lube. I'm holding it. I'm going to slowly begin to insert it. So Mr. Jones, as I insert it, make sure you are breathing and let me know if there's any pain or discomfort. We're just going to slowly insert it. If there's difficulty going around the prostate, other parts, we can have them breathe more and we can slightly twist it as we insert it. So we're going to insert it until urine's coming out or as far as we can, and it may go all the way to where it splits. So I'm going to hold it with my right hand, keeping it secure. I'm going to let go with my left hand. I'm going to reach over and inflate the balloon. Within, his isn't going to inflate, but when it is all the way inserted, we would pull back and make sure that it is inflated and staying in place, and then we can let go and we can remove the syringe and dispose of it. And now we don't have to be sterile anymore, so I'm going to remove my gloves because of the lubricant and hygiene. I'm gonna put on the gloves. So now we're just gonna be cleaning up and making sure that it is in place. As soon as it's in place, as the urine is coming out, we need to make sure that this bag stays below area. So I'm gonna lift that out with the box. And again, we don't want to pull that tight. I'm gonna get the Catheter. So with this, we would go just by the port. And around the port, we would secure it. And then we would lay this on our patient's leg like this, making sure, again, there is enough slack in here so it's not gonna pull and it's stuck to his leg. And then with the bag, we make sure to go under the bed. There's a hook under here. Again, making sure not to put it on the bed frame or anything that is gonna be a moving part. So if that's secure, we can get rid of everything else. If there's a ton of lubricant or other things, we can clean up and do some peri-care. We can have our patient straighten their legs. Okay, Mr. Jones, we have it secure and in place. You'll be monitoring it. You have your call button. Make sure you call us if there is any complications with it, if you're having pain or discomfort, or if you feel that it is leaking or anything. But it should be good to go. We'll also document on the catheter. We can put it on saying the RN's name, the date and time of insertion, so that everyone else who has it, they can make sure when it was inserted to monitor it. If you need to get a urine, if we need to run a urine test, we can gather the urine from within the bag within 15 minutes, or we can go from the port and get it from there.